Welcome to News from the States, where we bring you reports on key developments across Nigeria's 36 states. Let's start off with workers in Lagos State, where the healthcare sector union in Nigeria have threatened to continue with the ongoing strike if the government fails to meet its demands in writing. Senior correspondent Sharon Ijason has the story.
Major public hospitals nationwide services have been grounded from clinics to laboratories and wards as health workers under the Joint Health Sector Unions Johesu shut down operations. The union says the indefinite strike, which took effect from midnight November 14, follows the government's refusal to implement the adjusted consolidated health salary structure despite several meetings and warnings.
Last year, we signed an agreement on the 29th of October 2024, of which federal government agreed to implement that adjustment, but that has not been done. So we issued a 15-day ultimatum as provided for under the section 41 of the Trade Dispute Act. Of course, as it is now, it's a trade dispute, and we expect government to go ahead, approve this adjustment, circularize the issue a table, and then make a payment plan.
Across the country, federal hospitals have fully complied with the industrial action, leaving thousands of patients stranded without access to essential care provided by nurses, laboratory scientists, pharmacists, and other critical health professionals.
Quite unfortunate that the government had allowed this situation to slide to this level. It was only a day before the expiration of that ultimatum that government called, and while we were even called, they just wanted to say what is the problem, not that they had solution to it. The solution or panacea to this ongoing strike is for government to call the Presidential Committee on Salaries to hold their meeting and approve the said amount that had been calculated and gazetted and sent to by Salaries and Wages to that committee. The expanded neck will be called, and if the members are satisfied with what the government has offered, then that is the process by which the suspension of the strike will be called for by the members.
In Lagos, the situation is even more dire. Public hospitals were already operating at reduced capacity following the ongoing strike by resident doctors, and by December 2nd, health workers in the state are also expected to join the nationwide action, a development that could completely shut down medical services across government hospitals.
As the health workers continue their strike, which has been on for more than a week, they are expecting the federal government and relevant stakeholders to yield to their demands to ensure a swift return to work. Sharon Ijason, TVC News.